So forgetfulness can be a part of aging. However, aging does not result in an inevitable loss of cognitive abilities. As we age, as we all know, both the body and the brain change. Parts of the brain may shrink, especially in areas important to complex mental activities. Communication between the nerve cells or neurons in the brain may reduce. Blood flow to the brain may decrease. Inflammation can increase, but the brain remains able to adapt to new challenges and tasks. And it's not clear why some people's brains age better than others. Cognitive reserve may play a role, which is the brain's ability to work well, even when part of it is disrupted, excuse me. Signs of brain changes as we age include more challenges with multitasking, taking longer to complete tasks, increased difficulties finding words when we're speaking, slight decreases in abilities to pay attention, a harder time finding things that are used often, such as keys or glasses. But we can all still learn new things, even though it may take longer, create new memories, and we can all improve our vocabulary and language skills. Scientists have found that given enough time, older adults do just as well on complex memory or learning tests as younger people. In fact, healthy adults usually improve in areas of mental abilities such as vocabulary. And what I'm going to talk about next is how certain areas of thinking may show a decline as we age, others remain stable. So how cognitive function may change as we age. I'm going to go through 6 different areas of cognitive function and how some aspects of that cognitive function remain stable and others may change. So in the area of intelligence, crystallized intelligence remains stable. That's knowledge or experience accumulated over time. But fluid intelligence may decline. So those are abilities that are not based on experience, thinking and reacting quickly, multitasking, or learning new information. Long-term memory is relatively preserved, but short-term memory may be more vulnerable to aging. So recent memory or the formation of new memories. And we may need to hear or see information more times in order to learn it if it's new to us. In the area of attention, simple or focused attention remains stable, so focusing on just one thing, but divided attention may be more challenging. So again, going back to that multitasking aspect. In the area of language, as I mentioned, verbal abilities, including vocabulary, are often preserved, but word finding may take longer and be more difficult, whether that's in conversation or trying to recall the names of people. The information's not lost, but it could be more difficult to retrieve. In reasoning and problem solving, ways that people have learned over the courses of their lives to approach problems is maintained. And for those problems, that the wisdom of experience can actually lead to better problem solving than in younger people who haven't had that experience. But new problems that have not been encountered at all in someone's life may take longer to figure out for someone who's aging. Processing speed, so the ability to process and perform activities, remains relatively stable, but the speed decreases. So it takes more time to take in information and formulate an appropriate response. And so complex tasks that require a lot of quick information processing can be challenging. And a great example of that is driving, when you're continually noticing and processing and responding to a lot of information quickly and at once. So something that I get asked a lot that I really wanted to talk about today is what's the difference between age-related forgetfulness and a serious memory problem? As we all well know, we've all forgotten a name, where we put our keys. If we locked the front door, we all forget things every once in a while. But serious problems with memory or cognition make it hard to do everyday things. And I've listed here some of the things that someone might notice if it's a serious problem with memory or cognition. So asking the same question repeatedly, getting lost in familiar places, not being able to follow instructions, becoming confused about time, people, and places, forgetting how to make change or use the telephone, not taking care of oneself or making poor decisions or judgments often, trouble having a conversation or forgetting the names of everyday objects. And the one that I really want to focus on is changes in long held habits. Because some of these things we may do our entire lives, right? But some of them may be new. So, for example, if there's someone who usually keeps a really clean house and then it is very messy, that would be a big change in someone's ability to manage their daily life. Or someone who is very social and usually very involved, going to a lot of social events, reaching out to friends, if they suddenly withdraw, that also would be a big change. Um, Especially if it's something that they really enjoyed. So I think the thing to keep in mind is thinking about the specific person and what they were like for most of their life, and then has there been a significant change? And these are some of the changes that we might notice. So next, I'd like to talk about risks for brain health. And things that are detrimental to our overall health are also not good for our brain health. So, smoking reduces blood circulation to the brain. Drinking too much alcohol can slow or impair communication among brain cells, even with moderate use. And in older adults, alcohol affects the body differently and may interact with medications. Um, Undiagnosed or untreated diseases such as diabetes, heart disease, high blood pressure, other health problems are all risks to brain health because they can cause blood vessel changes in the brain and an increased risk for stroke. So, something that I'll be saying a lot today is that it's important to talk to your doctor, get regular checkups, those kinds of things. Risk of head injury. So, older adults, again, as we all know, are at a higher risk of falling and other accidents that can cause brain injury. So, you might not think of reducing your risk of falls as improving your brain health, but it actually does. Something to keep in mind. Something that we're all struggling with right now, I think, in one way or another, is social isolation. So, little social activity has been connected to poor physical health, such as cardiovascular health. And the research has shown that there's an increased risk of cognitive decline in dementia and mental health, such as depression and anxiety, with little social activity. Um, and I'll be talking more a little bit later about some of the opportunities we have to get socially connected. But if you're looking for any resources around getting socially connected while we're all staying at home, please let us at Age know. We are here to help with that. Untreated depression may affect physical structures in the brain. Um, if you have a poor diet, that can affect the brain as well because it doesn't have enough nutrients to function well. Insufficient sleep. During sleep, the brain forms connections that help process and remember information. And the lack of sleep can affect long-term memory, short-term memory, and overall health. Lack of physical activity. So some research shows that physical exercise may be a factor in decreasing risk for cognitive changes as we age. So these are, all things that people often say to us to avoid these things to remain overall healthy, and they will also help promote our brain health. So something that in my work I have found that people may not be aware of is that there are several treatable medical conditions that can cause memory changes. And so it's really important to go to the doctor and um, get these things investigated if you're experiencing changes in memory or cognition, because once these things are treated, changes in memory or cognition can improve. So if we don't know what's causing the changes, then we don't know what the treatment would be. So these are some of the things that are treatable. So a vitamin deficiency, tumors or infections in the brain, some thyroid, kidney, or liver disorders, medication side effects. So that could be one medication or combined medications or um, using alcohol with medications. Again, don't change your medications without talking to a doctor. Um, but that is an important thing to know. And then these last two are related to sleep and depression. I'm going to cover more in the next two slides. So I want to talk about sleep apnea. Um, it means that you have one or more pauses in breathing or shallow breaths while you sleep. And those breathing pauses can last from a few seconds to minutes and may occur 5 times or more an hour. Typically, normal breathing then starts again, sometimes with a loud snort or other type of sound. And untreated sleep apnea can cause an increased risk for all the things listed here: high blood pressure, heart attack, stroke, diabetes, accidents, memory loss. Um, and here are some of the signs to look out for. And these, of course, could be symptoms of other things. But I think the thing that I'm wanting you to take away today is these are some of the things to look out for, to get investigated, to look for, to get treatment for, to talk with your doctor about. So restless sleep, that loud snoring I mentioned, sleeping more during the day, having headaches in the morning, trouble concentrating, irritability and moodiness, and forgetfulness. And again, the treatment comes from your doctor and can be quite effective. And you may notice as I go through some of these slides, there's a lot of symptom overlap in a lot of these different things. And that's why it's so important to talk to a medical professional to figure out exactly what's going on. I want to talk about depression in older adults because a lot of times the ideas that we have about depression um, are actually not true, and it can look very different in older adults. Um, so I want to really talk about depression. Um, it is a treatable medical condition, and it is not a part of aging. Older adults are at an increased risk for depression, but it's often misdiagnosed and undertreated. Um, so having more chronic illnesses or having changes in our functioning can increase our risk for depression. And both of those things tend to be more common as we get older. So some of the symptoms to look out for um, are, things that last more than 2 weeks. Um, and so we often think of feelings of sadness as being the main um, thing for depression. It actually may not be the main symptom. We may notice in older adults being more irritable or grumpy, being more tired than usual, and then having changes in sleep. Um, it's easy to mistake some of these more common symptoms in older adults as a natural reaction to life changes or illness. And so it's always good to just ask, can I be screened for depression? Um, or if you're a care partner, asking, can this older adult be screened for depression? Um, it's good to note that the majority of older adults are not depressed. It could be, 5% in the general population, but it can be as high as 13% for people who are having health concerns. Um, Other symptoms of depression to mention are lack of motivation or an empty feeling. Again, this difficulty focusing or remembering, loss of interest in activities, changes in eating, feeling guilty or helpless. And then physical symptoms that don't have a clear physical cause or don't ease with treatment. And then, of course, always safety first. If someone's having thoughts of harming themselves, we always want to take that very seriously. Um, there can be a stigma around depression. So finding a way to talk about depression with an older adult is really important. Thinking about what benefit of depression treatment might appeal to them. So maybe talking about how it's a medical condition and can improve quality of life, that might help someone be more open to seeking treatment. Um, and it's important to note that the symptoms can overlap with dementia, but depression is treatable. Um, and some of the treatments include medication or talk therapy, physical exercise can help. There's lots of things that can help. I really want everyone to know that this is a treatable medical condition, and getting it treated can really improve quality of life. Um, Now I'd like to talk a little bit about changes in memory or cognition for which there is no proven treatment at this time. There's no treatment that cures or reverses the physical changes that are occurring in the brain. So we're shifting from treatable causes to things that don't have any cure. And I would just want to talk briefly about each one so that you kind of have an understanding of the different types of dementia and what each one is and what the symptoms are, because a lot of times people will ask me, what's the difference between Alzheimer's and dementia? And so I really want to just take this portion of the presentation to provide a lot of clarifying information about that. And I'm going to start with something called mild cognitive impairment. So this is more cognitive changes than are expected with aging. However, there are fewer changes than occur with dementia. And again, this is not comparing ourselves to others. This is comparing ourselves to our past selves, if you will. Um, so these are changes that are going to be noticeable by family or friends, but they're not severe enough to significantly interfere with daily life and usual activities. A person with MCI is still able to perform lots of daily activities. Um, and there's no single cause. I want to talk next about the causes of dementia. And a lot of those same causes of physical changes in the brain and dementia are also happening in MCI, just to a lesser degree. When someone is diagnosed with MCI, their symptoms may stay the same over time, but they do have a higher risk of developing dementia compared to the overall population of older adults. And then I have listed here some of the symptoms of mild cognitive impairment. And many of these things are things that we've been talking about so far. Um, so again, changes compared to the person's previous level of functioning in memory, cognition, mood, um, those kinds of things. So now I'd like to talk about what is dementia. As I mentioned, people often ask, what's the difference between Alzheimer's and dementia? Well, dementia is a general term for symptoms that have many different causes of physical changes in the brain. And so these are significant problems with cognitive function that can affect anything that you're seeing here. So people often think of just changes in short-term memory. I think it's really important to know that dementia affects the brain globally. It's not just memory, it's also reasoning, problem solving, controlling emotions, learning new information, language, visual perception, attention, personality changes, and it interferes with daily life activities and relationships. So I often think of dementia as this umbrella term, and then underneath it, there are many different types of dementia, and they are often named after the person who discovered the disease or the symptoms or the physical change in the brain. So it's a little bit confusing. I'm going to cover the most common types of dementia here in a moment. But it's good to just think of dementia as this umbrella term And then there's different types of dementia. Um, so first I'm going to talk about Alzheimer's disease, which I think is the one that most people have heard of because it is the most common form of dementia. It can be 60 to 80% of dementia diagnoses, and it's usually people who are over the age of 65 that are diagnosed. The early symptoms are that short-term memory loss that are really the hallmark of Alzheimer's disease. Um, and there are medications available that may help treat the symptoms, but don't slow disease progression. Of course, there's developments on this front every day as scientists and researchers are working on more treatment. Um, Changes in the brain are caused by deposits of protein in plaques and tangles. Those are kind of the two key physical structures of protein in the brain that are interrupting communication between nerve cells and causing damage to nerve cells in the brain. And that is causing the symptoms that one sees with Alzheimer's disease. Excuse me. Next, I'd like to talk about vascular dementia. And this is one that in my work, I have seen that people might not be aware of as much. So this could be up to half of dementia diagnoses, and it's usually between age 60 and 75. And unlike Alzheimer's disease, the changes may appear suddenly or they may appear over time. And we're looking at changes in language, judgment, planning and organizing, changes in movement, and it depends on where in the brain damage has occurred. And that's because vascular dementia is caused by strokes or brain injury or bleeding in the brain. And so depending on where that has occurred, that can cause the change. Sometimes people have, a lot of small strokes over time. And so it can appear to be progressing slowly. Sometimes people have, one larger stroke and maybe they recover or don't have any physical symptoms, but there's a change in their memory or cognition. And that is what vascular dementia is. And I think people often think, oh, a stroke affects us physically. Well, it also affects our brain as well. Frontal temporal dementia is one that I really want to bring to everyone's attention. It is a smaller percentage of dementia diagnoses, but still quite common, especially in people under the age of 65. And you may notice here in the early stages, in the early symptoms, changes in memory are actually not included. And so that can often be very confusing for people who are living with someone who's experiencing cognitive changes. They're experiencing personality or behavior changes, changes in language, speech, or understanding, changes in movement. So maybe leaning a lot more than they used to, or getting a lot closer to people than they used to. And so it's really hard to know, what's going on. And so I really like to talk to people about this type of dementia and bring awareness to it because it is a type of dementia and it's important to get that diagnosis and get things checked out. Um, and when we're talking about this type of dementia, it's damage to the nerve cells in the front and side areas of the brain. And it's named after the area of the brain affected. And it's not, there's not a common type of change in the brain happening. It's really about that area of the brain being affected. Now I'm going to talk about dementia with Lewy bodies, also 10 to 15% of dementia diagnoses. Here we're looking at memory loss, so that's similar to Alzheimer's, but changes in movement. There can be changes in gait, changes in balance, there can be fluctuating confusion, there can be hallucinations, so seeing things that aren't really there. That can include like misconstruing something that's there. So seeing a plant in low light for example, and thinking that it might be snakes, things like that. And also sleep disturbances. This is a really good example of why it's so important to get diagnosed because, as it says here, anesthesia and antipsychotic medications may be contraindicated, and we would only know that if there was a diagnosis of dementia with Lewy bodies. Um, and the Lewy bodies are abnormal clumps of a particular type of protein in the cortex area of the brain, and that leads to this type of dementia. So again, some of these symptoms here are things that people might not be aware of when it comes to changes in memory or cognition. And then just to make things even slightly more confusing, there is mixed dementia, which could end up being half of dementia diagnoses. And this means that more than one cause of dementia is occurring in the brain at the same time. So there could be a mix of symptoms, and it may not be clear exactly what symptoms are coming from what type of dementia. So if someone is having Alzheimer's disease and vascular dementia, for example, that means that they're experiencing those plaques and tangles of protein from Alzheimer's disease. And then maybe they've also had some small strokes that have also damaged parts of their brain. So multiple things can be going on that are causing multiple types of symptoms. So it's good for people to know that that's something that happens as well. So what to do if you're worried about your memory or cognition, or if you know someone and you're worried about their memory or cognition. So as I've been saying all along this morning, make an appointment with your doctor. The annual Medicare wellness visit includes an assessment for changes in cognition. And once we know the cause, we can get the right treatment. As I mentioned earlier, it could be a medical condition that is treatable. And then with treatment, um, the symptoms improve or go away. Memory or cognition may return to how it was before. But if it is something more serious, then you'll know what's causing it. And then you can take steps for treatment, support, planning for the future, getting help, whatever is needed. And I think once we can kind of name something, we know a little bit better how to deal with it. So these are the steps to take if you or someone you know is concerned about memory or cognition. So now I'd like to talk a little bit about how dementia is diagnosed. So as I've been mentioning, the first thing a doctor will probably do is see, is there an underlying treatable condition? So they'll look at the person's medical history, do a physical exam, do some lab tests, try and figure out what's going on. There could be cognitive and neuropsychological tests, and these assess memory, problem solving, language, and other abilities related to mental functioning. A psychiatric evaluation would help understand if depression or another mental health concern is happening that is contributing to the changes in memory or cognition. And then finally, a scan of the brain can help doctors understand what is happening physically in the brain. Um, and so a doctor obviously isn't going to do all of these things at once. There's steps in the process. And if you have any questions about, going through these steps or finding the right doctor to help you through these steps, reach out to us and we're happy to help with that. So as I mentioned earlier, what's good for overall healthy aging is also good for brain health. So research shows that some things may help maintain brain health and some are still being studied. So we used to think, a previous view is that as we age, our brain inevitably changes. Brain cells inevitably die off and are not replaced. And then this led to the idea that, nothing could be done. But now we know that certain things can sharpen the cognitive processes, can improve quality of life, can help people feel better. And so I'm going to talk in turn about each one of these. But I think it's just good to know there are things that you can do to promote your overall health and to promote your brain health. So taking care of your overall health. So um, if I've said it once, I've said it 1,000 times this morning, getting regular well checks with your doctor, getting recommended health screenings, um, asking about medication side effects and possible interactions with medication, getting screened for depression, talking about sleep concerns, managing health problems, quitting smoking and reducing alcohol consumption. Your doctor may bring up some of these things at your well check. You might consider, bringing this list to your doctor, a similar list to your doctor, and saying, I'm concerned about my brain health. Can we, this is what I'm noticing, or I want to be proactive. Can we see if any of these things are going on, and how can I be proactive in terms of taking care of my overall health? So while physical exercise has not been proven to prevent or reduce the risk of dementia, emerging evidence suggests that it may play a role. Um, so physical activity, as we all know, is great for our overall health, and it may play a role in reducing dementia. So it improves connections among brain cells, improving heart and circulatory system health, reducing risk of diabetes and stroke, helping with depression, preventing falls if we exercise to improve balance and coordination, and supporting independence in day-to-day activities. As always, it's important to ask your doctor what's safe for you and to start small and slow. If you haven't been exercising in a while, you don't want to get injured right out of the gate. So walking, chair exercise, incorporating different types of exercise is great. Aerobic, strength, and stretching are the three main types. And working up to 30 minutes on most days is a good goal. But I think with this and with many things, something is better than nothing. Um, so even if you're going for a 10-minute walk once a day, you're doing something, and that's something to be proud of. So eating healthfully can contribute to brain health. So a number of studies found that a diet rich in vegetables, especially green leafy vegetables, um, and cruciferous vegetables like broccoli, were associated with a reduced rate of decline in reasoning and understanding. Keep in mind proper portion sizes and taking in adequate fluids, drinking a lot of water, um, but really focusing on a diet that has a lot of vegetables, fruits, whole and unprocessed grains, fish and seafood, healthy fats, lean meat or poultry, um, and less fat, sugar, and salt. I think that eating healthfully can often be a challenge, balancing that with quality of life. Sometimes I think the things that we love to eat that might not be good for us really make us very happy. So that's an important balance, I think, to make is, making the decision for you in your life and what's going to help promote your brain health and, make you happy and keep your quality of life. So, having fun and staying socially connected. So, emerging research suggests that doing activities you enjoy may help maintain well being as you age. So, older adults that do what they believe to be meaningful say they feel happier and healthier. And some studies show that people who stay socially active and connected with others tend to have lower rates of dementia, although, again, no specific activity has been shown to prevent or slow dementia. Researchers have found that high stress levels impair learning and memory in both animals and humans, and strategies to reduce stress, such as exercise or meditation, may be beneficial. Um, and so, something that can kind of combine multiple things in one would be, meeting new people over a common interest and volunteering. There, you're doing something you enjoy, you're meeting new people, and you're being socially connected, um, and you're doing something meaningful all at once. Um, so I know, again, this is something that can be especially challenging in our lives right now. We're happy to talk with you and brainstorm some ways to work some of this into your life. A lot of services have popped up that are helping people do this in a socially distanced way, in a safe way. We're happy to connect you with some of those services if you'd like. So brain exercise, this is a question that I also get a lot. Studies have found that engaging in challenging cognitive tasks may protect against age-related declines in thinking and the risk of developing dementia. So one of the questions I'm often asked is, what brain exercise should I do? How often should I do it? Um, and here are some ideas of what to look for because it's a really personal decision, and what works for one person may not work well for another. So some of the qualities you would look for when you're looking for brain exercise is something where you're learning new things. You want it to be enjoyable and personally relevant. Obviously, that makes it more fun to do, but research has shown that that actually makes it more beneficial for your brain health as well. And you want it to be challenging, but doable. Um, I think something that we often focus on when we're doing brain exercise is getting the right answer. And I think it's important that just trying it is the important thing. There's no grades. You don't have to show anyone how many you got or didn't get from a puzzle or whatever, but just putting forth that effort and trying, you've already won because you're getting the brain exercise that's great for your brain health, and hopefully you're having fun doing it. And so here are some things to try to get great brain exercise: playing games or doing puzzles, reading and discussing books or magazines, um, watching something like an educational video, a sporting event, or going on a virtual tour of a museum and talking about it with someone. So that is a great way to have fun, connect with someone else, and get brain exercise. So reading aloud and discussing it, discussing what you've read is really great brain exercise. Not only discussing what you thought about what you read, but also discussing what you read, sort of reading comprehension type questions. So I want to talk a little bit about strategies to support new learning, and these are often called active strategies. Um, and there is some evidence to support that difficulties in storing new memories can be due to the fact that we're not using strategies to encode this information as we're learning it. Um, so if we have cues and we have strategies that we use, we're more likely to remember new information. So here are some examples of things that you could try. So memory tools, that could be repeating a person's name when you meet them and try to come up with an association to recall their name. It could be something that rhymes or your favorite song, whatever it might be, something to help you remember their name. Keeping organized using calendars, to-do lists, notes in a notebook or a pillbox, that can always help us support new learning. Taking more time to actively process new information. So talking about reading and discussing something, that is actively taking time to process new information. You're not just reading it and setting it aside. You're reading it, talking about what you read, talking about the facts and the information you read, and then also discussing your opinion with someone else. That is helping you actively process new information. Following a routine, putting frequently used objects in the same place, and then coming up with your own cues and strategies. If you have something that is relevant to you and is the most helpful for you, you're more likely to use it. It's more likely to benefit you. So again, coming up with these personalized things. There's no one size fits all, but finding what works for you is really going to be the most effective. So how to get started? That was a really long list of things to do to promote brain health. So I really just wanted to talk about getting started. So just choose one thing that you can do to promote your brain health. Think of small steps where it's easy to feel successful, and think about combining benefits for brain health. So taking a 10-minute walk, adding one serving of vegetables, making an appointment for a well check, Make sure you write down what you're going to do and when, and get support from family and friends. And then notice how you feel when you succeed and celebrate small victories. So, a great way to combine benefits could be, talking to a friend when you're both going on a walk a few times a week, so that you have someone that you're doing it with and you have that accountability and you're getting social connection while you're getting physical exercise and while you're outside. Adding one serving of vegetables a day or trying a new vegetable once a week. Again, this is something you could do with a friend, socially distanced. You can both decide to try the same vegetable and the same recipe each week and then talk about how it went. Um, really get creative and find something that appeals to you and sounds like fun to you and that is also going to promote your brain health. So I want to take a moment here to talk about the fact that it's challenging to get help, and this can be a difficult topic to talk about. Um, when we're talking about memory changes, it's normal to feel overwhelmed, to have a lot of emotions come up. As I mentioned, I work with people who are experiencing early memory loss, and there's a lot of feelings around those cognitive changes. Um, we at Age want you to know that you're not alone in those challenges. And there are organizations like Age and other organizations that are here to help with support and resources. So, changes in memory have a lot of stigma in our society, and I think that adds to the difficulties to talk about this subject. As humans, we're reluctant to admit or discuss our own shortcomings, and that can make it harder to have insight into cognitive changes. Some people just don't have insight into their cognitive changes, and that's part of their disease. Um, but that can make it a lot harder to deal with some of these changes. People may feel like, how is going to the doctor help? I know a lot of us don't like going to the doctor, and I can definitely understand that. And so, really understanding, as I've mentioned, that this could be something treatable that the doctor can help with, to get support and information. I think fear of losing independence is a big one. I've noticed that a lot in the people that I have worked with. And something that I often say is that getting help early and just in the areas that it's needed actually can help maintain independence in the long run. So if you think about it, if you're having a hard time, let's say maintaining your house or mowing your lawn, if you get help in just that one area, you may be able to stay longer. Um, I think, again, as a society, it's really hard for us to ask for and receive help, but we all love giving help. And so maybe thinking about it in terms of, by receiving help, I'm giving a gift to someone else because they want to help me. Um, so kind of reframing that. If it's maybe an adult child or a spouse, thinking about, okay, they want to help me because they want to be a good daughter, son, spouse, sister, whatever it might be to me, is another way to think about it. People have a lot of fear about being diagnosed, understandably, wondering how we might feel, what we can do, how to get support. And just know that, you know, once you get a once you get a diagnosis, you'll know what you're dealing with and you can face it better. And then you can create your care and support team. Um, we all face challenges, and often we find a new way to find meaning in those challenges. So we offer support groups. There's lots of people doing research about these diseases. That's a way to give back. So there's lots of different ways to cope with this and find meaning and get through some of these challenges. And we're here to help. Um, and family and friends, of course, can help, whether someone's concerned about their memory or someone is diagnosed. Um, and as a family or a friend, you can really help someone live the life that they want if they are having cognitive changes. You can help them stay active, keep up their routines. Um, you can answer their questions about what's going on. You can help them remember to take medicines or visit the doctor, provide them with support on a doctor's visit in terms of asking questions or bringing concerns to the doctor. You can help them come up with structures in their life to maintain a routine or help them be independent in daily life. So a big calendar to highlight important dates and events, a list of plans for each day, um, notes about safety in the home or written directions, a list of things by the door of things to remember when they're going out the door. Things like that. I think there's lots of things that we can do as family and friends of someone living with cognitive changes that can help support them in continuing to live um, in a large part the life that they want to live. We at Age are here to help. Natalie, of course, in the Resource and Information Center, can answer questions and provide information and referrals. We have care partner support and education. We have support groups. Our Caregiver U program offers evidence-based classes and research-informed classes for all different issues related to being a care partner or caregiving. I also would really like to focus on virtual connections. That's the program that I'm the program director for. And that's the last item here on the slide, small group virtual activities for people living with changes in memory or cognition. So virtual connections is a monthly subscription program, and we offer virtual activities over the Zoom platform for people living with different levels of cognitive challenges. So we basically talk with you individually about what your goals and needs are, and then we come up with a service plan based on that. We come up with a personalized video meeting schedule. We offer, one video meeting every day of the week, and each one's an hour to an hour and a half. It could be brain exercise, a social group, bingo, music, a support group, reminiscence, all different kinds of activities. And we really try and match your preferences with those, your preferences, goals, and needs, and cognitive challenges as well with those activities. And this is a really great way to build social connection, be engaged, get, brain exercise, meet new friends, and have fun from the comfort of your home. And also just try new things. Um, and we really work as facilitators in these groups to engage everyone in the group. So it's a chance for the person living with memory changes to do something independently, and then whoever else is living in the home, if they want to go do something else, they can. Um, so it's a really wonderful program, and I'd be happy to talk with you more about it. We are currently accepting new clients. I want to end with just kind of some overall observations. A lot of the stories that we tell ourselves or the stories that society tells us can be negative about what we can't do. What things that we can't do as we age, things that we can't do if we're experiencing changes in memory or cognition. But we at Age, and something that I really love about my role and my job, is that we really focus on what people can still do, on the abilities and strengths and wisdom that remain. And we accept our clients, whether in virtual connections or our Thrive Social and Wellness Centers. um, we accept people where they are in terms of their symptoms. And we encourage them to be themselves, and we appreciate what they have to share. Um, Here are some quotes from some of our clients talking about how our groups help them find meaning, purpose, and enjoyment as they're living with cognitive changes. Um, I think often, when we're changing, the people at home and people close to us really notice the changes. They notice the losses. But at our programs, we've just met this person. We don't know what's changing. We don't know what's been lost. And so we're just really happy to hear what people have to share. Um, so I just really wanted to share that with all of you. Um, Thank you so much for coming today. I'm happy to answer any questions that you have. I really hope that you found this information useful and helpful. And please know that we're here to help. Here's my email. and my phone number. Please feel free to reach out with any questions or concerns, whether it's about age programming or about anything I've mentioned today, about, ideas to promote brain health or support someone with dementia in your life. We're here to help in any way that we can. So I'm going to invite Natalie to come back on and share with us any questions that have come up from the group.
Thanks, Casey. So there is not a lot of questions. There's one that says, when you were talking about FTD, it says FTD does not have memory loss, but called dementia.
That's right. That's right. So dementia really refers to globally affecting all the different areas of cognition, and memory is just one aspect of that. So depending on where in the brain the physical changes are occurring, and what part of the brain has been physically affected and how it's been physically affected, that is going to determine the symptoms. So it's not necessarily memory. It could just be judgment or word finding. There's lots of different ways that it could be affected. Great question.
I have another. This one is, I can scroll down. Okay. Will virtual connections continue even after COVID?
Oh, that's such a great question. Did anyone bring their crystal ball today? And they can see into the future. I absolutely love virtual connections. I am actually also the Memory Connections Program Director, which is a small group program that was meeting in person at 5 community locations once a week for people living with early stage cognitive changes. And that program is on indefinite hiatus because of the pandemic, and we're offering virtual connections in its place. I would love to continue offering whatever is needed in the community. So I cannot make any promises about what will happen, but I know that there's a lot of need out there for people living with dementia and for their care partners. And I think we at AGE want to do whatever we can to meet that need. So I think my goal is just to continue learning what the needs are and how we are able to best meet them. So no promises, but I sure hope so.
Thanks. There's another question asking if age is associated with neighborhood senior centers. So we are not directly associated with the senior centers, but we, pre-COVID, were very active within the community. We have an amazing outreach team that would sometimes deliver health equipment or incontinence products to individuals attending senior centers. We would also drop by with a lot of literature and just flyers on upcoming events and educational opportunities. So that's how we are connected to neighborhood senior centers. That looks a little different right now because of COVID, but we are hopeful that we can once again get back out there and be as connected as we once were. Let's see. I have another. Says, I have a question about my grandfather. He seems much more focused on food. He gets extremely excited about every meal, and he never used to be like that when he was younger. Is this due to a change in the brain or more of a personality change?
Oh, that's such a great question. And I get this question in different forms a lot of the time. It could be around eating. Oftentimes it's around emotions. So my person is really easily angered. They didn't used to be like that before. Is that dementia? Is that depression? Is that the fact that they can't drive anymore? What is all that about? And I'm not a doctor, I'm a social worker, so I can't necessarily speak to that. I do know that dementia comes with changes in eating and changes in taste. So and changes in smell. And so things that used to taste good may not taste good anymore since our sense of smell is so connected to our sense of taste. People with dementia tend to prefer sweet things a lot more. And people with dementia tend to forget that they have eaten. So they may say that they've eaten when they haven't, or they may just keep eating because they forget that they've eaten. Um, so something that I often focus on here, obviously talking to your doctor, I've said it a million times, but also thinking about quality of life, right? If this is something that makes him really happy, then how can it be incorporated into his routine in a way that's safe for him and is feasible for whoever is partnering in care with him, if that makes sense. So for example, if someone had diabetes and they're wanting to eat sugar all the time, like obviously that's not going to be safe, right? But I sometimes say, what's the worst thing that can happen if this person does that thing? Are they going to end up in the emergency room? Is it going to be safe for them? Um, and so that's a great conversation to have with the doctor. And again, thinking about not only the grandfather in this situation, their quality of life, but the person who is making all those meals, if it's not the grandfather, their quality of life. So like if they are exhausted and tired of making 1,000 meals a day, that's an important factor to consider too. So I'm happy to talk with you more one-on-one about your individual situation if it would be helpful as well.
Another question we have is some medications that are used for certain diseases like cancer do cause similar symptoms in dementia. How long should someone wait to get specialized care?
Oh, that's such a great question. Um, I think it never hurts to ask. So oftentimes when there is one main chronic disease happening, whether that's cancer or kidney disease, diabetes, dementia, whatever it may be, speaking to the doctor who is overseeing that chronic disease can sometimes be a good place to start, in part because that may be the doctor you're seeing the most often. But I think, especially in this case, if changes in memory or cognition are due to um, the medication that is being administered to treat the cancer, it could be something that once the cancer treatment has completed, maybe those memory changes might resolve. So I think it's a great question to ask um, whatever doctor you're seeing regularly, but especially the doctor who is administering the cancer treatment.
Thank you. Let's see. I have another one. I am a caregiver for my wife who is in early stage dementia. What are early indicators to reach out for external in-home care? So when is a good time to?
Oh, that's such a good question. And it's very personalized. This is a very personal decision. Um, I think in my role, what I often try and do with caregivers is I take my professional experience and what I've learned, and I share it with you so that you can apply it to whatever's going to work for you and your person. So that's what I'm going to do here. I'm just going to share with you what I've learned, and then obviously you determine what's going to work for you. Something that I have heard often is that the sooner you bring in someone from in-home care, now this is let's set the pandemic aside for a moment here, okay, just to be clear. The sooner you bring someone in for in-home care, the more accustomed the person with dementia gets to it. And because they're in the earlier stages, it may be easier for them to understand it or easier for them to adapt to the change. Some people are very resistant to having someone come into their home that is not a friend or a family member or a neighbor. And so starting that process early can sometimes be very beneficial in terms of resistance from the person. The other thing I really like to think about is, as a care partner, what is your quality of life? So getting, just the process, and Natalie can speak more to this, I think, just the process of finding and hiring and bringing someone in for in-home care, that takes time and effort. So doing that before, in the early stages, usually someone can be left alone. And so doing it in the early stages could be easier than doing it as symptoms progress when the person can no longer be left alone. And then in order to do that work, you have to find someone else to engage the person with dementia so that you can take care of that work. So it can be easier if you start it earlier because as a caregiver, you may have more energy, less burnout, more time available to you than you may have later on, even though it's less time than you had before. Um, so those I think are the two main things. Oh, one other thing that I just thought of is sometimes a way to present it to the person living with dementia is this person is coming to help me. They're coming to help me do the dishes. They're coming to help me clean the house, fold the laundry. Or this person really wants to get to know you. They want to come and play cards with you. They really want to come and take you for a drive. They're really interested in learning about you and knowing your life story. And they're excited to get to know you. So, really thinking about um, how to make it more palatable or better well received to the person with dementia. And again, I'm happy to strategize that with anyone one-on-one, but I think the way you present something obviously will often, um, I think having it being well recepted, having the person with dementia receive it well, is a really important indicator in hiring in-home care. Natalie, do you want to add to that at all?
Yeah, I think it really just depends on the family and this and the particular people. And planning ahead is also, really important. And it's also very inclusive. So you can also include the person who this care will eventually be for, and for because it's for you too. But having them included in that conversation is a really, a great way to go if the situation is set up for that, and if they're open to having that conversation. There are a couple of questions about resources.
Natalie, before you move on to other questions, sorry, what you just said made me think of one other thing. That is an excellent point, and I often also suggested that, so I'm so glad that you brought that up. I think whenever you can include the person with dementia in making these decisions, they then have buy-in and whatever it is. So sometimes, saying like this will really, like, I need you to help me, so I need you to be open to this because it helps me. Um, but just, finding out from them, what do you want your life to look like? Do you want to continue living here with me as long as possible? Okay, how can we make that happen? These are the challenges that I see, and these are some ways to address it. Which of these would you be open to trying? And then we can revisit how it's going. And again, this is very personalized depending on the person's willingness to talk about this and their cognitive symptoms, right? The conversation I just described may be too abstract and have too many choices for someone with certain symptoms. Um, but I think as much as possible, if you can involve them and then write up a plan and have them sign it or somehow indicate to them some sort of visual reminder, this is something we discussed together and we both agreed on, I think can be really great. Also, in these difficult conversations, involving a professional can be helpful. So having a geriatric care manager or another family member or some other professional who can deliver the news or provide recommendations, I think can often make it more palatable to the person with dementia. So let's say it's a spouse looking for in-home care for a spouse, and so they're both older adults and the care partner has a chronic condition, going to the doctor and saying, hey, I have a chronic condition and I'm also a caregiver. How can you make this sustainable in the long run? Have the doctor say, I'm going to write you a prescription to get in-home health. And then when you go home with a person, you can show them this prescription and say, the doctor told us we need to do this so that we can stay independent. I think relying on that third party can also be really helpful.
Thank you. Let's see. We have a comment from a caregiver, which is coming straight from a caregiver. And this person says, try having these discussions before a diagnosis is made or even considered. And that's very important to also consider. Um, so there are a couple of questions. We are recording this session, and this will be sent out to everyone on Monday. We need a little bit of time to convert the video. So yes, the PowerPoint, the recording of this webinar will be sent to everyone by email. So please share it. If you have somebody who wasn't able to attend today, feel free to forward it to them. Also, there were a couple of questions about resources and a list of in-home care resources. Yes, we definitely have a list of in-home care resources that I'm happy to share with you. Please reach out to me. My contact information will be also in the email. You should have already received my contact information in another email that was sent out. So yes, we do have that available. There is a question about a private care attendant, which is outside of an agency. So we do not have a list of individuals who are able to provide that type of care. We have a couple of resources that I will share with everyone in the email that is sent out on Monday, listing a few platforms that you can go to find somebody locally. So what I have and what AGE has is a list of agencies that provide in-home care, and then a couple of resources with platforms that you can reach out to for private pay attendance. And let's see. We'll take one more question and then we will wrap up. Let's see. Is there a certain stage of dementia when a person becomes more combative with care?
That is a really great question. I think, as many of you will know, being a caregiver for someone with dementia is a very unique challenge, and every day can be different and every person is different. I think it depends on what we might mean by combative and what we mean by care, right? There are people who are in the early stages who are not safe to drive, and they are very resistant to that, and they still try and drive and get very angry about that, and really resist it and do whatever they can to try and continue driving. There are others who maybe accept those changes in the early stages relatively easily, but then, as the disease progresses, they object to some certain type of care. So, for example, showering, let's say, and let's say that it's someone that they don't recognize who's trying to help them remove their clothing and shower. And if they don't understand who that person is, what they're trying to do, they are going to resist that, wouldn't we all? So I think it really depends on the person. And I think that I've already said this, but it's worth repeating. The really important thing at that point, obviously, we're trying to provide the best care we can to the person with dementia, but the care partner's quality of life is really important there too, right? That's a very frustrating, exhausting experience if the person is resisting whatever it is in whatever way they're resisting it. So that's where we can help brainstorm some strategies to try and help kind of work with the person's routines and with their symptoms, as opposed to trying to kind of shift them out of it. So often we join them in their reality, or we kind of go with whatever it is they want to do. So for example, let's say they get out of bed and they don't want to go to the bathroom and brush their teeth and wash their face. They want to go straight to the kitchen table and have their coffee. And then it's very difficult to get them back in the bathroom to brush their teeth and wash their face. Well, maybe you have them brush their teeth and wash their face at the table. Um, Maybe they don't like taking their pills when we say, here, Dad, it's time to take your pills. So maybe instead the pills are just on the table and we're all drinking, everyone is drinking a glass of water and taking pills. And it's kind of those nonverbal cues are just cueing that person to go ahead and do it. It's a lot of trial and error. And it is very individualized. And so I'm happy to talk to anyone who's experiencing resistance in partnering in care in any way with someone with dementia, to help it be a better quality of life for both the person with dementia and for the caregiver. It's very common in a lot of different ways.
Okay, I just want to make sure. Oh, somebody did mention that there are functional driving tests that can be done with, I believe, some local hospitals. So this is, do you want to share a little bit about what that is?
Yes, absolutely. So driving, we can have its own seminar on driving, obviously, but I think driving is a great example of, as this caregiver commented, thank you, let the decision be on the professional. Anytime you can have a professional delivering news that might not be well received, definitely do it. So sometimes, I've heard of people going to the doctor and the doctor says, you have dementia, you can't drive home. And the person is like, you haven't seen me drive. What? And so there's this wonderful program at St. David's where they actually watch the person drive and then tell the person, okay, you can drive, but not at night and not far from your house. Or you can drive, but only with someone else in the car, whatever it may be, but they've actually seen the person drive. And that, in my experience, working with people with early stage dementia, has been a much more satisfying experience for the person with dementia. They may still grieve that loss or have a hard time with it, but at least a professional has actually seen them drive and then has told them what they're observing. So as this caregiver mentioned, you can't just sign up for this service. You have to have the doctor refer to this service, and we have an information sheet about this service that we can provide. The driving is just a whole other challenge, and we're happy to help with that as well.
Absolutely. And actually, over the summer, we had a driving seminar, and I have noted that I will actually include that as well in the email. Everybody has brought up really wonderful resources and great points, and I will definitely include that in our email that we send out on Monday. I also want to mention that we will be sending out a survey, and we would really love for you to just take a few minutes to fill out this survey. We love feedback. We want to know what topics that you want to learn about in the future. We do this for you, so we need your feedback and appreciate it. So we will go ahead and wrap up. I just want to thank everyone for attending today and spending some time on your Saturday with us. Again, you will receive all of this information on Monday with the survey. So please fill that out. And thank you.
Thank you all so much. Thanks, Natalie.